So we ready? We ready for
We are ready for Dr. Tyler Mock is presenting us today. Please welcome Tyler.
Thank you. Cool. Hey everyone, I am Dr. Tyler. I own Restart Physical Therapy. Before anyone asks, yes, I do have my doctorate degree, and no, since they're not here, this joke is bad, but I'm not part of the Highlight Academy. But yes, so my question today really is about ads. What are they? How are they? Why are they? Basically, digital ads are what I want to focus on and kind of dive into more. So just to be a little bit more specific on how to do that, what are the best practices for it, just want to get more information on it. So what I do, so my clinic is a private pay clinic. It's one-on-one care for a full hour. It's hands-on approach, so I spend my entire time with you for that full hour. And my goal really is to create a healthy environment for both patient and provider. So what I mean by that is that, so these are my credentials, but before I started my career, I was already burnt out. So what happens in a normal clinic is that a physical therapist, a doctor, would see you for maybe around 20 minutes in the first visit and then 5 to 10 minutes at the second or third. And that's not how I wanted to treat, because I can't tell what you are doing, what your pain points are in 10 minutes. Just because of insurance and everything, they don't pay for that amount of time for me to, and we have to stack our patients. So I'm seeing 3 to 4 patients each hour, and other than that, it's the paperwork afterwards to justify why you saw them for those 10 minutes. And then it's just a whole mess. So what I wanted to do is just make a clean break from that and just treat my patients how I want to treat. One-on-one, perfectly check on their exercises and everything. Right now I have a patient who has back pain, and so one of the easiest exercises to do is a glute bridge where you lift your hips up off the floor. You're supposed to be using your glutes, but when I'm observing her and seeing how she's moving, I notice she's putting a lot of pressure and a lot of strain on her back instead of her glutes. And that's actually making her back pain worse. So like not being able to supervise the exercises and could actually make you worse. So why would I send a college student who doesn't know what they're doing to show you your exercises when that could actually harm you instead? I know that because I had 11 years in the physical therapy student and as a college student who didn't know what I was doing. So basically, I know the entire field from being the cleaner to the exercise expert and everything. So that's how I wanted to build my clinic. So I specialize in manual therapy, which means I'm hands-on for about half an hour trying to see how your body moves, what I can do to make your body move better. And then the other half is the exercises, supervised, make sure you're doing it right. And I'm keeping track of how well you're doing the exercises, when to increase your weight, how to improve the strength of your muscles. So what I've been doing, my ideal client is sports injuries and post-surgical. Those are my bread and butter. That's what I do well at. And so in order to increase my market, I've been doing social media content, average 500 views, 300 accounts reached. Some people say I'm pretty funny, so you can follow me on Instagram. Networking, I'm part of the South Lake Chamber. I go to Solutions Networking. I do everything local here, host a few events here and there. And that's where most of my leads come from, usually from people who know me, vouch for me on word of mouth pages on Facebook and everything, and that's where I get most of my leads. I've tried Facebook ads before. This is an example of one of my ads. So giving away free physical therapy. The first session is free, and then trying to get them to get in for the first place to see how well the quality of physical therapy that I provide. So the best one that I've had was 14 leads and 2 converted, trying to nurture that. So email, text, call, everything, trying to get them in my office, and then silence. So 2 converted, so that was great. But other than that, that ratio. I want to try to get that a little bit better. Let's see. Yeah, so just to be a little bit more specific, my goal is to see 10 visits per week. This is part-time work, so I don't have that much time right now. At least 4 patients, new patients a month will help me get to that 10 visits per week for now. So far, I've only been spending $150 monthly ad budget on Facebook or Google. I kind of switched between the two. Google ads got me website visits, but no follow-through. So basically, my ask is, how much should I spend based on like my budget and everything, or how much would be more effective? Do I convert those leads when they sign up? Do I make my my follow-through more streamlined that way? And just overall meta ads, what have you seen worked for you, and how can I incorporate it into my business? And yeah, that's basically it. You can follow me using the QR code on Instagram, check out my content and everything, and yeah, I'm looking forward to all the advice.
Dr. Brooks, everyone.
Thank you, Tyler.
You are funny on Facebook and Instagram, by the way. I've seen them.
So he's got some good social media content, some clever content there. How do we help him get it out to where it needs to go? Jose?
We'll go back.
I mean, one point that is important is you are going after a specific market, right? Because it's an out-of-pocket patient, which is not under insurance. So when you are doing your ad, you need to focus on that particular segment, right? I mean, it's who is your target market? What is their income? Where do they live? That information needs to be considered when you are doing those digital ads, because don't consider everybody, because most of your patients we need to pay for that, and most of the people are under insurance. So something to consider. It's first start with the target customer, understand that pretty well, and then go to design the ads and look for the geography where you want those ads to reach.
Yeah.
And Jose, he can get help from you, SBDC, right?
Brady with Lakeland Realty. A couple of things. Do you have somebody that's working your social media for you, or are you doing all of the work yourself?
It's just me.
Just you. Okay, so maybe hiring somebody that can get you the results that you're looking for can be a little expensive, but I think worth it. Secondly, maybe when you're targeting your ads, maybe target the villages, because I feel like those are the people that are probably more into getting those physical therapy needs, and zoning in on certain areas where you might find the customer you're looking for.
Cool. Just a comment on that. So legally, I can't see anyone on Medicare. So that might change in the next year or so. There's bills making it that physical therapists can opt out of Medicare. But as for now, I can't see anyone who's 65 and above. So that's a little stipend. So that's why I want to focus on sports rehab, focus on those weekend warriors, those who are kind of well off, but like not necessarily, on the less young age, So yeah, I mean, that's basically it. Or the students with, targeting the parents and everything.
So Brandy, a follow-up for that. He's spending $150 a week on ads. Could he get a social media consultant? Yeah, for that?
Probably not. But I mean, if you're making your own content, then you could hire somebody a lot cheaper. I mean, I'd say probably $2,000 a month to manage and get you results, because I haven't seen your social media, but everyone says that it's great. So it's just somebody that knows what they're doing to get the results that you want.
I have a source that oversee for that budget. You can do it. I don't use them, but I've seen them used for some of the other people.
That's a great.
Yeah.
So you service people who are hurt mainly?
Yep, basically anyone who has joint or muscle injuries. I specialize in martial arts and golf. I am a martial artist, so I know how to incorporate, the recovery and then bring you beyond recovery. It's more so once you get better, how do you move your body again to the proper channels? So, yeah.
Nathan, I could probably talk about this for a few hours, as Banks figured out yesterday, unfortunately. SmartComms, as far as social media, it's a really good AI-driven platform that I think it's $100 a month for 2 posts every single week. It's really cheap. It's not going to be high quality, but I mean, if you're just trying to be active, you have to determine what your cost per acquisition is. Whenever you are seeking 4 new customers every single month, how much is that customer worth to you, and what are you willing to pay to get that person in the door? For digital media, you're probably not going to be able to accomplish that for less than $500 a person. So as you're spending $150 a month on Facebook, you're going to get 1 new person about once every 3.5 months. So I don't know if that's what you're looking for, but this is a very large investment that you need to make if you're planning on it, and doing it in a minimal approach really doesn't get you that effective communication that you're trying to get.
Gotcha.
Hey Tyler, my name is Don from Ellis Entertainment. When you get those leads, as you're talking about from Facebook, are they opting into something, or are they just reaching out to you? And so my thing would be create some type of lead generation, a lead generator. So a PDF, an ebook, something that targets that athlete, but maybe get very specific on that.
Cool.
Create that, have them when they come in, they download that. Now you've got their information there. And maybe, I don't know if you're targeting like a landing page on your website instead of just the website itself.
Gotcha.
That would also speak that same language.
Yeah. So I use the Facebook instant form. So I, not just the general information, but I try to have them fill in like, oh, what do you need help with and everything, so that they're actually a little bit more engaged in just sending their contact information and like just giving it to me. So trying to incorporate like what is their pain point, and then incorporating it in my messages, going back to them, giving them calls, scheduling it and everything. So
My point is to offer them something of value up front.
Okay.
And not have them have to do all of that work, but go ahead and guide them up front for free, and then
Gotcha.
go from there.
Dr. Tyler. I actually know Dr. Tyler. I was one of his patients, and I've seen you at workshops. I have followed your social media. For me, I almost see it as an identity crisis, because the social media is phenomenal and it's entertaining, right? All the videos you do, the fun stuff, it's so much fun. But for me, in my head, there's a disconnect. If I were an end user, what is it that you actually do for me? I can see that you do fun videos and all that cool stuff, but how does it translate in terms of my pain, or if I'm an athlete and I need your help? So I know your work ethic, I know your knowledge. You made a comment about Highlight Academy. I would work on the persona and also the image, so people can actually see you as a doctor, show the transformation from corporate into personal world, and why you decided to actually help people in a private sector, to spend more time with them and to really help them versus doing paperwork. I would do one video about that and really talk about the person that you are, the experience you have, and then I really focus on that one target market. And if it's athletes, do videos about pain points and how your physical therapy has helped, and show the transformation that you've made for or helped others, right? From point A, 10 sessions, 5 sessions later, they're running and winning and doing whatever they're meant to do. So that is what I am missing from knowing you and seeing you in all the great videos. So you have the talent to do the videos yourself. I actually believe 150 is enough. Once you are micro-targeted and you're able to create the videos that show the transformation that you can do for people, and focus on that and nothing else.
Cool.
And saturate the market.
So for me, it's a question. for you. You mentioned martial arts and you mentioned golf.
Hmm.
Do you target golf clubs, association, martial arts schools, et cetera,
I've tried.
to target to that audience and become very relatable to them and show them the benefits of working with you?
Yeah, I've tried, but I guess like what Micah was saying, like in terms of my content and everything like that, I'm trying to, I guess, bring that population through digital means, I guess. So when I create my content further, it should be more catered to that a little bit more. So right now, trying to get into golf clubs and martial arts schools. I guess I could do a better job at trying to incorporate it, but usually it's hard to go in and.
I was looking at your social media right now while you were speaking, and I saw you have some things that are catered to that, but I was just wondering if you're part of like one of their associations or go to their events or anything like that, so you're like in front of them, talking to them and letting them know that you specialize in that area.
Yeah.
For those athletes.
Yeah.
Versus just rely on social media if you can get out of the clinic.
Yeah. I try. Yeah.
Just, I wanted to ask, you mentioned it's a part-time, this is kind of part-time for you.
Right.
Your practice or?
My practice right now is part-time. So Mondays, Wednesdays, and Saturday mornings I'm in my clinic, and it's right by Citrus Tower. So
you've got the content, you're creating the content. It's more the matter of where to place these digital ads and how to most effectively use what it sounds like would be a lower budget monthly to use the content that you're creating. So where you want those to go, right? So maybe some additional ideas about unconventional platforms or different ways with that limited budget, more creative and nimble ways to get the content that he is creating. To Brandy's point, he's creating his own obviously fantastic content. How do we help him plug into other uncharted territory where his own content would shine?
Ken Rose, I'm going to put on my Minuteman Press marketing hat for a minute. My advice to you really is you're talking about golf, maybe tennis, cycling, pickleball. Those are all event-based things, and my recommendation would be to do events. For example, if you do a golf tournament and you have a tent set up with your name, you're going to speak to 160 people that day that come to your booth. That's the greatest source of potential clients. Same thing at a cycling race. To sponsor a part of that or have a booth there gives you the exposure to the client you're looking for. Social media is great and everything, but people just scroll and scroll and scroll. If you're physically in front of people, they get to know who you are and what you do. And really, that's the biggest part of business.
Ken, how much does it cost to sponsor golf?
So we just signed up for the South Lake Chambers golf tournament at Green Valley. It's $250. We'll have a tent on one of the holes. We'll have signage. We'll be out there, and we talked to 100. They're going to have 120 golfers, potential clients to visit you. Everybody gets hurt on a golf course. I mean, I did, so.
What is the lifetime value of a client for you?
Good question. If the PT answer is it depends. So like post-surgical, it could be 3-6 months, and what I have there is like a $1,000 monthly package where they see me 3 times a week, and so that could range between, I guess, 4 to 6K, and then individual prices are $150. 6 visit packages, 12 packages, usually around $800 to $15K.
Okay.
$1,500.
So what I've found is that generally one customer kind of looks like the next customer, right? So in your case, for example, you're talking about martial arts. So if one person is hurt at the gym, they probably know somebody else after the gym has been hurt. So how do you motivate, or what are you doing right now to motivate your current customers to share you with other customers? And are there restrictions on you with this being medical that would prevent you from giving somebody a free session if they send you a referral for a new client, for example?
Sorry, what was the last part? The last question?
I don't know if there's anything that would prevent you from being able to offer, for example, if I'm a client, can you offer me a free session if I send you a referral for a new client that signs up with you?
Oh yeah, so like right now, like my first visits are free because I don't want people to make sure, like they're not sure if like a private pay session would be worth it for them. So just to get their trust a little bit more, I have them come in just to see how I work with them, how detailed I am with their body, and then at the end of like whether they're getting better and everything, and I kind of, what we do is just discharge them. Basically, I ask them for reviews or like, what clubs are you going to? Is there anybody there that would benefit from my help? So basically, trying to follow through on that end, and then also making connections with different exercise studios, gyms, everything. Just trying to say like, oh, like after they're done with me, I can send them to you, something like that, like some sort of discounted price, or if they send someone from me, how do I get them better so that they can start up their gym membership again and everything like that. So yeah.
Okay, I mean, yeah, something like that works. I find it directly compensating somebody specifically, like up front. If I send you a referral and they turn into a $6,000 customer, if I got 1 or 2 free sessions out of that, I'd be pretty happy.
Right.
Versus then hoping to, eventually, I mean, referrals are great going both ways, but if you're talking about not talking to other business owners who are used to doing referrals, but talking to customers, it's, what does this do for me? Like, I might love you as my doctor or my physician or whatever, but I'm not necessarily going to remember or be going out of my way to recommend you. But in the back of my mind, I know, hey, you know what, somebody just the other day was talking about how they hurt their shoulder while they were rolling at jiu-jitsu. You know what, if I make a recommendation, I might get a free session out of this. And I'm doing it because I already enjoy it, but I'm not necessarily thinking about it. But once that motivation is there, it makes it much more likely that people remember to share your information.
Gotcha.
Thank you.
So one thing I've thought about that may be helpful for you, maybe you've already done some of this, is if you've partnered with any kind of massage therapist or a chiropractor at any point. I'm not sure how much that would overlap, but I am very into martial arts, and we, probably within the last 6 months, took on a massage therapist that rents space in our gym, and we get a little discount as members of the gym. So we get sore a lot with what we do, but you will have guys that will blow their knees and their elbows and their shoulders out, and they will have to take 6 months off. So they kind of need a way to rebuild, and sometimes it takes them a lot longer to be able to fully come back into the sport if they don't do the proper training. So I see there's definitely a need for what you do. I think it's just finding who are the sources of people that are also helping to take care of the athletes within a gym.
Yeah, South Lake Chamber and everything, every direct primary care person I'm involved with, trying to reach out to chiropractors a little bit more. There's a little bit of a rivalry between PTs and chiros, so I personally don't have anything against chiros, but some people have. It's a little bit of a rivalry, so some chiros won't, cater to that a little bit, but try.
So I had about 20 thoughts as you were speaking, but let me just stick to 2. You mentioned martial arts, golf, that sort of thing, right? As far as potential clients?
Mm-hmm.
Yes?
Yes.
So you knew you were coming here a couple weeks ahead. Did you schedule a meeting with a golf pro here, anyone here, and bring you a ton of marketing material?
Tried. I guess probably not hard enough, but something like that.
So there's a fine line between being annoying and also getting in the door, and
right.
There is no exact formula for that. I guess until someone tells you to go to hell or get off my lawn, you got to keep pushing. The second point is, and I was thinking about what you said about time, and I get it, money. Listen, my first business 40 some odd years ago, I was dead ass broke, but I had to hire someone to help me. In your case, it might be a paid intern. Sounds like you're doing this, from what I heard, a couple days a week. You really don't have time. Social media is awesome, but at the end of the day, it's a ground game. It's being a politician in a good way, meaning kissing babies, shaking hands, making friends. And if you don't have time for that, which you do, I'm guessing on a Sunday, and since some of the venues you mentioned are open on Sunday, but during the week, you may have to dig deep, do whatever you have to do, find some money, get a really great paid intern, maybe one of the local colleges at a fair rate, and have them do the ground game for you. Again, social media is great, but this is any sales, at the end of the day, any relationship, and that's what you're trying to build, sustaining long-term relationships is foundationally based on a ground game.
And when you say ground game, you're talking.
Again, just getting out and meeting people. I mean, coming here is awesome. That's good on you. But you're going to get out and have to do, you know, even to this day, I'll meet someone for coffee at 6 a.m. or 5:30, have a breakfast with them right at somebody else afterward. You know, those are the things you have to do. Sleep comes about 10 years from now. All right? I still only sleep 5 hours a night, and I've built and successfully exited 7 businesses. Sleep is for later. Anytime you're awake, you're working.
Nathan again. So there's 4 different really types of marketing. You have SEO, SEM, organic, and then you also have, you know, your general ground game, your social media presence and everything like that. Each of those areas you could probably spend $5,000 a month on in your local community, getting each of those areas. I've heard you're doing a little bit of paid advertising through social media. You're also doing organic. I haven't heard anything about SEO and SEM. Whenever you look at your website right now, physical therapy is mentioned once on that entire first page. Whenever Google searches that website, they don't even identify your website as a physical therapy website. So you really need to look at some of those items to understand how you are perceived, not just by your community, which whenever you're trying to gather traffic matters, but it does not matter to Google at all. You have to really go and dig into how those other companies that will push traffic to you actually view you based on the presence that you have to them.
Cool.
That's a really great point, Dr. Tyler. So you can also, you want to target those keywords on your website. Not to sound like a robot, but you definitely, what are people searching for when they are searching for your service? You can also take all those pictures that you have on your website. I'm blanking on the name of the website you put them into, but you can go and actually geotag those pictures with keywords built inside, embedded within the picture, which will also help your SEO. When it comes to Facebook ads, there's a lot of different views on, do you target it, do you like niche it down to moms with preschoolers, etc. Like you can get pretty far. I like to go with the idea that leave it wide open, put a geographical 10, 20 miles, what have you, but you reach that target audience with the ad copy, with the ad graphic, not necessarily niching it down. Other people might have a different opinion on that, but definitely that's a good point. Work on your SEO.
That's called alt text.
Yes. Vault text. Vault.
ALT.
Thank you. Thank you.
Okay. We'll take one more in the back there.
So before I start, quick question. You said you're only doing this part-time. What are you doing with the rest of your time? Do you have another full-time job, or why is it just a part-time venture at this point?
I am PRN at a different clinic, so that's basically where my time is.
What's your time horizon between leaving that position and going full-time with this?
Probably in the next 6 months to a year.
Okay, so what I'm hearing a ton of really great ideas, a lot of really good suggestions for you. But I think a lot of what you're doing right now, to me at least, sounds like a shotgun approach, and kind of as I can get to it, as I do it, doesn't seem to be a lot of really laser-focused attention on your part in any of these individual areas. You're just kind of doing a little something here, do a little something there, do a little something over here, hope it works, cross your fingers. It's going to be really, really difficult to do anything well when you're only doing it ish. Does that make sense?
Yeah.
So there's a ton of really great ideas. A lot of very intelligent people, and I'm sure a lot that are much smarter than myself. But I would suggest you figure out something that you laser focus on. If it's your social media that costs you nothing, because your ad budget right now is pretty low. Okay, to this gentleman's point, that's not going to do a whole heck of a lot for you. You would do a lot better spending that $150 to this gentleman's point of finding a local event that you're actually going to be able to set up a tent and a table. In my office building in Mayland, Stretch Lab came out. We had a big event one day. They came out. They had a couple of massage therapists come, set up tables, and everybody that was there, they were, helping us get stretches, things like that. Got to actually experience what they were doing firsthand. Made a whole lot better, impression on me than just simply seeing a Facebook ad as I'm scrolling. I don't know the last time I actually clicked on a Facebook ad. I see an ad, it's white noise, I just kind of go beyond it. But those first person touches, when you're able to actually get in front of somebody, tell somebody what you do. The example you gave a few minutes ago about the person who had the back pain, and they were just simply doing their exercise wrong. Now, they were taught to do that by some sort of medical professional, but they weren't observed in how they're doing it to do it right, and it wasn't helping. So that little nugget is something that if I were you, I would use in my social media. Do some things like someone else mentioned earlier, the freebie, right? You're gonna give out something for free. If you can become known on social media as the expert in physical therapy and why your physical therapist or your chiropractor, your massage therapist either did it wrong or didn't give you enough of a clue, enough help, rather, then you become that elevated expert in the field. Now people are looking at you as the expert physical therapist, not just a physical therapist, because there are a plethora of them in the area. Do something that's going to set yourself a little bit apart. Those areas that you really want to focus, golf and martial arts, things like that, have some of your clients, I've never seen your social media. From what I hear, it's very funny and it's great, but are you focused on why you're the expert that they should go to? So do some free lessons. Someone else over here mentioned, going to your landing page and have a free ebook or free something. Do something that says, listen, if you are a golfer and you're experiencing this, elbow problem, whatever you feel is the most common injury, these are the top 3 things you need to be doing to correct that and make sure it doesn't happen again in the future. Click here to get my video. And now all of a sudden, there's your stream. That cost you $0. So that $150 a month, you can be putting toward an event, go meeting people in person, as opposed to putting out in a shotgun. I hope the right person sees my Facebook ad, and then I hope they actually click on it, and then I hope they actually call me. It's a lot of wasted money versus getting in front of people.
Thank you. Lee, last question.
Okay, so my last question is, I know that you're not taking health insurance. Do you take net benefit or flex benefit Visa cards? Because how many here have that kind of pre-tax money put in a healthcare system? How many?
Yep. So yeah, I take HSAs, FSAs, all that.
Okay, so that is something you need to put it out there. So because people are preventing to go to you because they don't want to spend the out-of-pocket money if they already have a healthcare paying for it. So tell them that, you accept that, and that is one filter for you that people will say, okay, at least I can prepay and then take that money to go to see somebody's out of the network or out of the thing. That's just my
Dr. Tyler Moak, would you like to finish with a few words? What can you do with my elbow here?
That's beyond repair.
I tell you, he's funny.
But yeah, just follow me on Instagram. Just keep me accountable, I guess. I'm trying to figure out what I need to do next.
Thank you. Thank you.
Thank you, Tyler. There's Tyler's social media right there, so you can obviously find yourself some entertainment on it. And also, I appreciate that ask of help keep him accountable. That's what this is all about, right? Being up here, being a little bit vulnerable about what our trials and tribulations are with our business. So thank you for that, Tyler.
And we're going to see him in
that.
6 months. You're going to come back and see if it works or not.
Absolutely.
Right?
So
when it works.
Grab that QR code as you're thinking about more things throughout the week. Heaven forbid something happens where you need some physical therapy. You have the contact information right there. But thank you, Tyler. So I think we've kind of, as Banks phrased to you, what can we as a community do for you? And I think your answer was perfect, help keep you accountable. So that's ideal right there. He's, this is his business, this is his livelihood. He's branching into it and he's having some, should I or shouldn't I? And I agree, that was fantastic and useful feedback. So we look forward to seeing how that serves you.
And this